Let's start with the news from last evening at the White House, where President Trump said that he's going to suspend contributions to the World Health Organization. From your experience with the Ebola crisis, how critical, how important was the WHO in fighting that virus, and what does it say about possibly our withholding funds from that organization at this critical time?
Well, it's an extremely ill-advised move, and it has far more to do with Trump's domestic politics, I think, and his dipping poll ratings in terms of his handling of the crisis than it does the WHO and any desire to strengthen the global health response. Three-quarters of U.S. funding in terms of assessed and voluntary contributions goes to such tasks as fighting polio, measles, tuberculosis. And so what he's eating into is steady state funding, the funding that the United States has been giving for many years. The United States has made no major new announcements about how it's really going to respond to the pandemic and how it's going to use the WHO and other international agencies to avert a humanitarian catastrophe in the developing world, and a catastrophe that, of course, will blow back to the United States because of our links through trade, through global supply chains, through family ties, and so forth, to even remote parts of this earth. So it's, I think, more of an act of spite and diversion than anything. That said, WHO has not performed, I think, optimally. I mean, there was too much deference to China at the beginning. I think that also speaks to the absence of U.S. leadership within the organization. The fact that China has been able to leverage a very modest contribution to the WHO speaks, I think, to the U.S. retreat from organizations like that. But the WHO needs to go back and look when the time is right and when it's not trying now to prevent millions from dying, maybe even the risk of billions being infected. I mean, there's 3 billion people in the world, David, who can't wash their hands at home, who don't have clean running water to do so. And so with all of these people at risk, right now the WHO is working on trying to ensure that governments in the developing world who don't have the kinds of cushions that we have, and we've seen our challenges managing our response, but who don't have stimulus packages or $2 trillion bailouts coming, impoverished communities, vulnerable communities, refugees. The WHO is out there and trying to offer technical advice as to how those communities can withstand what is about to hit them. And this will just mean that the WHO is now instead scrambling to figure out how it fills the gap that Trump is leaving, but also how it mobilizes the new funds it needs to really ramp up those efforts.
Ambassador Power, you make a very important point. You talked about being able to wash your hands, basic hygiene. You wrote in the New York Times recently about this great disparity, not just in the ratio of doctors to populace, but also, as you say, a lot of people around the world can't even wash their hands. So as much as we struggle with this crisis here in the United States, how much worse is it going to be in a lot of the lower income countries?
It's going to be devastating, I think, on both axes that we're experiencing, right? First, in terms of the lethality and the contagiousness of the epidemic itself. Because of close overcrowding and the close quarters in which people in poor communities often live, the ability to practice the kind of social distancing that we are managing, if we're lucky, in some of our neighborhoods in the United States, I mean, that ability is not there. And so when one individual brings the virus home, it's likely not only to infect whole families, but potentially whole neighborhoods, or at least whole city blocks or slum blocks. So if you think about refugee camps in Idlib or in southern Turkey, for that matter, if you think about the Rohingya refugee camps in Bangladesh, but even if you think of the favelas in Brazil or the slums of informal settlements in South Africa or in India, I mean, it is just going to race through those communities. And then part of that health concern and the sort of ravaging of the virus concern is that the health facilities to manage the spread, to get people in early, to hydrate them, to put them on ventilators. I mean, these communities don't have ventilators. If we had trouble, getting masks and PPE for our health workers, you can imagine what a refugee camp is going to be experiencing. So that's in the health domain, what the virus does and how much more contagious and more deadly it can be because of the absence of proper health care. Then you combine that, David, with the economic toll, and we're experiencing that here. That's why so many Americans need desperately the $1,200 checks because they don't have another source of income having been laid off. They have their families to feed. They have insulin that they have to buy for their diabetic children. I mean, that's in a developed country like this one, and we have had the stimulus package passed, and maybe there'll be more to follow. When that economic livelihood is taken away for families that are living hand to mouth in those slums or who are dependent on international aid that has now dried up because it's being diverted to domestic response, you can imagine even the risk not only of malnutrition but of outright starvation. And you saw in Kenya this week riots already erupting because food has become so scarce, just not because yet of the virus wiping people out or the virus wiping out the local economy in Kenya, but because now the markets aren't available for the goods that were being produced in Kenya because the flights have been suspended, so there's no place, even if you grow the products, no way to get them, to market. And so already we're seeing that economic toll, and that's before this has really hit in the way that we know it will in the coming days.
Samantha, you make a very powerful point about, given the fact that it's this bad in the United States, how much worse will it be elsewhere. Does it also, though, cut a different way? What is the U.S. capacity to really lead right now? Because unlike Ebola, for example, where we had some cases come back here, but it didn't ravage the country, it didn't ravage the economy, do we have the capacity right now, the United States, to really perform a leadership role globally on this pandemic? At the same time, we're trying to protect ourselves back here.
I think that's exactly the right question, and the answer is yes, we do have that capacity, but I think, of course, the perception is that we don't. And so why do we? Well, the kinds of people who would be pooling their expertise, whether scientific or public health or lessons learned in terms of what earlier countries have done. This epidemic, the one advantage of the way that it has spread is that it's staggered. And we have the ability to learn so much about, what has worked and when is too soon to reopen certain sectors, and what can we learn about antibodies and whether that allows a greater preparedness, again, to begin to flow people back to jobs, from that are not existing right now because we're shutting everything down. So we can learn. So there's a pooling function that stems from convening countries and really, drilling into the insights that can be gathered. That's already happening, I think, in scientific circles as it relates to the vaccine. It appears to be even without frontal U.S. leadership. Then there's the sort of look ahead in terms of our manufacturing cycles and those of others in developing countries. But it's not only about who's providing the PPE, it's about who's organizing the distribution of the PPE. And we have, David, huge amounts of experience in USAID, our aid agency, in the State Department, our diplomatic corps, and even there are parts of Health and Human Services and, of course, very significant parts of the CDC that are only internationally oriented. I mean, that's where the specialties lie of experts who work within these agencies. So it's not as if they right now, the individuals I'm talking about, again, who are only a small subset of the public servants active in thinking about corona generally, it's not as if they're currently working on trying to get PPE to New York hospitals. They are individuals who could very much be taking a leadership role at the United Nations, pushing a plan, either a U.S.-Chinese plan, which would be probably one that would rally the entire world, or just a U.S. plan, and getting countries to do their share of the task. And there are going to be many tasks ahead. So there are different personnel involved, different resources. The stimulus actually did include $1.3 billion for the international response, but no senior official seems to be taking charge to figure out how it gets allocated.